Imagine a hospital in Batangas every day. Patients need urgent help, mothers giving birth, children with fevers, accident victims. Despite the hard work of doctors and nurses, there's a hidden problem. The government owes the hospital 94 million pesos. This isn't money owed by patients, but payment for services already given to poor people. Because of this, many hospitals are no longer accepting guarantee letters from the government, a promise to pay for the costs of poor patients. But what's the use of a promise that's always broken? The government already owes hospitals over 530 million pesos. The effect, patients are turned away, families get deep in debt, and health workers struggle to get paid. As Reverend Robert Nazal said, every unpaid claim is a life at risk. How can services continue if there's not enough medicine, electricity, and salaries? This crisis isn't just about money, it's about the dignity of health workers and the safety of every Filipino. Their sacrifice shouldn't be met with neglect. In the middle of the crisis, Reverend Robert Nazal of the Bagong Generacion party list stepped up and filed House Resolution 34. Its goal to investigate the government's ongoing late payments to hospitals. 3 committees will work together: Health, Good Government, and Appropriations. They will check every process in the DOH, PhilHealth, and DBM. Where exactly is the money flow getting slow? The question is simple. Why isn't payment for services already given arriving on time? The 530 million pesos might just be the start. The total debt is expected to be even bigger. Every unpaid claim is a family losing hope and a promised service. It's also important to find out who should be held responsible. There are laws to follow, but they seem to be ignored. Neglect needs to be identified, and officials need to be held accountable. The investigation is a step to bring back trust in the system. It must be made sure that the law is for everyone's good. So why are payments slowing down? One reason, the government's faulty digital claims system, always having problems, slow and complicated. Instead of speeding things up, paperwork just piles up, and the process slows down. Also, releasing funds is a long and detailed process from the hospital, PhilHealth, DOH, all the way to DBM. There's no clear accountability. When there's a delay, agencies just blame each other. Lack of teamwork between DOH, PhilHealth, and DBM. They have their own rules, no synergy. Laws like the Universal Healthcare Act look good on paper, but they're hard to put into practice. As long as there's no clear direction and strict enforcement, the system will remain slow. Underneath all of this, a culture of neglect and a lack of urgency. For officials, paperwork is just numbers, but for patients, every day of delay is critical. Reverend Nazal's call public service is a sacred duty, not just a job. The government isn't the only one who should be held responsible. Some hospitals are also involved in overcharging and fake billing. Stricter audits and punishment for dishonest billing practices are needed. Transparency in hospital billing and a way for patients to complain are important. Digital systems should be fixed, processes made simple, and accountability clear. Congress has a big role to make laws so this crisis doesn't happen again. DOH and PhilHealth should act fast and show they are serious about solving the issue. Health is a right, not a privilege. Hospitals should be paid on time. No health worker should have to choose between serving and surviving. True universal health care should be felt by every Filipino, rich or poor.